Afternoon, everyone, and thank you for joining us today. This is our webinar on diversifying recruitment, which is the first of two webinars we are running, where we're celebrating and showcasing the SIHED Challenge Fund projects. For those who aren't familiar with SIHED, it was launched in 2018 by the Office for Students, and it's the Strategic Interventions in Health Education Disciplines programme. So the SIHED programme aimed to raise awareness of allied health disciplines and increase demand for those higher education courses. The SIHED programme officially ended in March 2021, but the Council of Deans of Health have been commissioned to take over the legacy of the SIHED programme, including showcasing the Challenge Fund projects. So we're going to be celebrating this Challenge Fund projects through a series of webinars, podcasts and blogs, which will all be on our website. And as I said, today is the first of two webinars we are running. And I'm pleased to say we're going to hear about two projects, one from Coventry University and one from the University of Leeds. So I'm delighted to be joined by Dr. Vicki Ensor and Dr. Elaine McNichol, who are going to speak about their projects with us today. They're both going to present about their projects, and then there'll be some time at the end for some discussion and for some questions, but we're really looking forward to hearing about them. So I think we'll kick off with Vicky. So Vicky is the Associate Head of School, Enterprise and Innovation at Coventry University. And I'll pass over to Vicky to hear more about her Challenge Fund project.
Great, thanks for the introduction, Robin, and afternoon, everybody. I got involved in this project. My role focuses on enterprise and innovation, so I get the good fortune actually to work with people across the school, the faculty and the university, and this was a project that we were really keen to get involved in, and for reasons why. I think my slides are going to be presented for me. Is that right? Fabulous. Thank you very much. So let me just move my video view so I can see my own slides. Okay. So the partnership was with the Better Health, Better Care partnership, which is the Coventry and Warwickshire STP, included our local NHS partners, and throughout the project we included service users and students as well. So we wanted to respond to the challenge with a project called Healthpro Challenge, using simulation and gamification interventions to support mature males and career changes into the health professions. Next slide, please. Thank you. So yeah, so the challenge was launched in 2018, and it aims to address increased awareness and understanding and the demand for allied health disciplines. If you look across some of the AHPs, there's some professions there that are really underrepresented. Actually, if you Google where you can study orthoptics and orthotics, there's only a couple of places in the country that provide those courses. So for example, orthotics is provided by Salford and Strathclyde, orthoptics, Sheffield, Liverpool and Glasgow. So if you're south of that, it's going to be difficult for you to get on one of those courses. And obviously in terms of demographics, there's an increase in demand for those services, so it's an issue. What we actually wanted to do as part of, I should also say, part of the Challenge Fund was to look at improving access to courses and then subsequently professions of mature and male participants. And if we go to the next slide, I can show you some data for Coventry University. So our own widening and access participation strategy identified that there's an inequality actually in terms of the number of mature males that are enrolled onto our health courses. If we look at the university on average, 53% are male students. But if we look into our School of Nursing, Midwifery and Health, that drops to 23. And then if we go into a bit more granular detail, we can see that in the professions, ranges from 16% in mental health nursing, which is relatively well represented actually when you compare to adult nursing at only 4%. So we wanted to try and address that. If you can go on to the next slide now, please. And if you look at mature learners, in terms of representation, we do have a good representation of mature learners, but actually considering the previous data, you can see that the majority of those will be females coming into the professions later on in the career. Actually, in terms of UCAS definition, a mature learner is somebody who's 21 years or older. So we wanted to address that. And when you speak to health partners and service users, actually the skill set that males bring into is quite different actually to the typical stereotypical female care that's provided in the health professions currently. When males are brought into that dynamic team mix, it changes the dynamics, and actually patients appreciate having males present that can take care of them when they're in hospital and needing healthcare. So it's important for us to look at this and address it. Next slide, please. So if we'll think about a vision, our vision would be, ambitious, a gender and age neutral healthcare workforce. If we think about the objective, it's to address the shortfall of males in nursing, midwifery and allied health professionals. And so we requested £50,000 from the Challenge Fund, and with a match of 50,000. So a total envelope of £100,000 to do the project. Next slide, please. And what we wanted to do was section up the project to try and achieve all of the objectives. We wanted to challenge stereotypes. Why is it perceived that healthcare is a female profession? We also wanted to promote the professions and make people aware of the variety of different healthcare roles that they can go into. We wanted to focus on marketing as well and do some bespoke marketing for this particular group of people we're looking to attract. And we wanted to develop some digital resources, because speaking to stakeholders, it was thought that males are likely to engage well with digital gamification types of marketing material. So that's the way that we went down. We wanted to try and enroll mature males onto our pre-registration courses, and then ultimately to disseminate those findings and to share the interventions across the patch so that healthcare providers could also use our marketing collateral. So that's the overview of the project. Next slide, please. And the way that our approach was to actually embed behaviour change theory. So what we wanted to do was basically nudge mature males along a journey of not even contemplating or realising that men could go into these professions. I mean, really starting as basic as that, and then nudging them along a journey through our marketing and innovative resources that we developed through the funding, was to start making them think, okay, then, so now I know about these professions, but I don't think it's right for me. It's not relevant for me. I've got, I know about them, but I don't think I've got the right skills. And then to sort of preparing them to start thinking, actually, I can relate to this, that, and the other, and I think I've got the right skills and values to be able to do well in this course. And then ultimately, okay, I want to apply for a course. So we developed our marketing and our gamified resources to kind of nudge people along that journey. Next slide, please. And so we developed a series of work packages. The first one, challenging gender stereotyping. So we produced a series of different videos and case studies with a hashtag, for example, David's story. We posted on YouTube and different social media platforms. And to talk about, to try and demonstrate the norm, break down that gender stereotyping and appeal to our male audience, our mature male audience, which, as I said, is age 21 years and over. And to create gamification that we could use at a variety of different events for people to kind of contemplate for themselves, do they have the right skill set? Is the way that they think relevant to healthcare, and do they have the propensity to work in the NHS? We created, as I said, the video campaigns to challenge the preconceptions, and we invited people to watch the clinical scenarios that we developed as well, and we hosted all of this onto different social media platforms. Next slide, please. And then we worked with the marketing and recruitment team to develop a series of open days and taster sessions in partnership with our NHS Trust colleagues. And we planned to either host events at the university within our facilities and then take them onto the clinical areas to show, you know, what it's actually like to step foot onto a ward or a clinical area. We did this as well in terms of virtual reality. So we had the face-to-face and the virtual reality resources that were developed. Yeah, and then we developed a whole load of bespoke open days for this audience to give them the one-to-one that they would need to get the confidence to actually inquire, ask the questions, and indicate interest for the courses and the careers. Giving them information as well in terms of what funding opportunities were available, and breaking down any anxieties that they might have, and questions or barriers that they might put up for themselves. Next slide, please. So one of the, I'm going to take you through some of the marketing and promotional collateral that we developed through the project. And we developed a bespoke website which directed people to a whole repository of different resources. And if we can just link through, I can perhaps show you a couple of videos to give you kind of a flavour of what this was about. Right, thank you. So yeah, so the website shows the different sorts of courses that we provide, and then we made about 15 different videos of people that have made that career change from a completely different profession into healthcare, and they talked about their journeys, their anxieties, their preconceptions, and how that was actually allayed through support. The website links to information from the NHS website about health careers, and also provides a quiz there for people to be able to kind of self-assess, do they have the right skills for healthcare, and actually what sorts of roles would be applicable for them. So if we can just link into the Watch More Stories, thank you. You see there's a whole host of different people there that we've interviewed and asked them to talk about their experiences. I'm just going to show you the introductory video, which just lasts for a minute or so.
Hello, my name's Martin Bollard and I'm the project lead for Healthpro Careers in Healthcare. I'm also a nurse and an associate professor here at Coventry University. I just wanted to take a few moments to introduce you to the project and some of the features on our website. Healthpro is an Office for Students funded project that looks at attracting more mature men into the wonderful and varied nursing and allied health professional careers such as speech and language therapy, physio, and occupational therapy. Healthpro aims to overcome some of the barriers that exist that typically prevent men from coming into the varied nursing and allied health professional courses that exist. We're using simulation 360 videos to try and overcome some of those stereotypes. On the website, we have developed over 14 YouTube clips that capture men from very different backgrounds that have chosen to come into nursing and allied health professional careers. There's a quiz on the website that can help you choose what career you may want to come into. There's information about our wonderful, highly rated Coventry University health professional courses. And there's also information, if you're unsure whether you meet the requirements for the degree, there's a link to Health and Human Sciences programme. It's never been a better time to have a health career. In recognition of that, the government is offering £5,000 each year as a bursary for specific professions such as nursing, occupational therapy and paramedics. I hope by visiting this website, it's your first step in entering and having a wonderful health career. Thanks for listening.
Thanks. So if we go back to the videos, it's just I'll just give you an example of some of these sort of case studies that we developed. Yeah, that's the one. Thank you.
My previous role in life was in the military. I was in the Royal Engineers, Explosive Ordnance Disposal. The skills I kind of learnt in that field, being able to emigrate directly across. It gave me a good solid foundation to going into healthcare, with communication, into collaboration of teams. At one point I was in Afghanistan working with Estonians and the Danish as part of a small team. So I think that direct teamwork, being able to organise efficiently, proactively, assess problems and help others. So it's provided me with invaluable skills that directly transfer across.
Thank you. So we can go back to the slides now. That'd be great. Thank you. So that's just one example. There was this, a series of different males that have made that transition into health, as I said, and each of them are talking about the different experiences and journeys that they've made. We developed this is an example of one of the flyers for one of our open events. So there was some digital sort of flyers and hard copy flyers that we sent around. Next slide, please. Just skip these quite quickly. And this is the setup at one of the road shows that we went to. This was actually at Catterick at the military base, and you can see there we've got some different banners that talk about, I used to be on the front line of bomb disposal, now I'm on the front line of healthcare. I used to write menus, now I write dietary plans. I used to set fitness goals, now I set treatment goals. So we went along that field of trying to promote, you've got transferable skills from your current career that you can bring on into a health career. Okay, next slide. Yeah, so and then you can see there that we've used hashtags there which relate to the social media for more information on the website. Thank you. Again, another flyer of our insight days. We did some bespoke insight days for different professions, and the one that we focused on really was military. And I can talk about that in terms of our learning at the end of the presentation. Next, please. And the gamification, we developed an app which we called Coventry Collaborate. And essentially, if you just want to just keep going through, because I can talk about this as you're pressing through, just give me a few seconds for each one. The app, what it does is creates a virtual hospital ward where the students work in groups and can see the panel of patients that they need to care. And actually, if you remember the Tamagotchi days, it's based on that idea. If you've got to work together as a multi-professional team to create interventions to keep your patient healthy and well and essentially alive. And as the students work through, they have to vote up the most relevant response to different situations that they're presented with. So it's very much a group work. It introduces people to the different professions so that they can see the roles of those different professions and how they come together to give that holistic patient care. And this is one of the resources that we developed to be used at the open days for people to kind of get an idea of, oh, I like the sound of that type of role. I think I can probably do that. So we use that. It's a shame that I can't show the actual app. The person that could have ideally have demoed it for you, unfortunately, she's on annual leave. So yeah, okay, I think I've explained that. Thank you. And so in terms of the outputs for OFS, we said that we would have 1,000 hits on our website. We said that we would develop this marketing campaign, we would develop some marketing resources, and ultimately we'd look for 20 applications onto our courses. We did exceed actually in the 3-month period, we got 2,000 hits. And then when we looked at the marketing campaign, we had lots of impressions, which means that our marketing was put in front of lots of 500,000 people. Lots of engagement on there and people spending time actually looking at the content on there. So we used a team of people that looked at all of that analytical data and presented back to us the effectiveness of our marketing campaign. We have got a repository now of videos that promote the professions and talk about those personal journeys. And I'm going to go on to lessons learned in a second, but unfortunately, COVID got in the way. The face-to-face days were limited in terms of how many that we could run, which was really disappointing. But we did actually have some success in terms of getting 22 people signing up to say that they were intending to apply. So we'll have to wait till September to see how that goes in terms of conversions from interest at the events into actually signing up. So if we go to the next slide, please. So if you think about, this is the last slide now, so if you think about what went well and what could have gone better, We were really pleased with the engagement for all of our stakeholders. We did a launch event at the very start of the project and got really well great attendance, good representation, including from service users and students that were really keen to get involved. It's actually quite normal for us at Coventry University to involve service users and students. We actually employ them to get involved in this sort of activity because obviously their voice is really important. Because of the in-kind contribution, staff were doing this on top of their day job, but we absolutely saw the value and we were able to sell it to staff when we got buy-in and, you know, support from start to finish in terms of delivery groups and steering groups to support the, you know, the project governance along the way. We have got a great repository of resources and bespoke marketing now, which without this intervention we wouldn't have, because the university doesn't invest in bespoke marketing so much like that. It's more generic. Unless we're able to secure funding for it. And I mentioned to you that we attended open days at Catterick. We've got a good relationship now with the military, because what's come from this is that the military personnel absolutely have such valuable experiences and skills and values that are transferable into health. And so we've come quite a long way now, actually. And in terms of legacy of this project, the fact that we've identified this new talent pool, we're working with NHS partners within our area as well to work together in working more closely with military and supporting people that are wanting to make that transition from the military back into Civvy Street and to support them into new careers. So what didn't go too well, obviously COVID scuppered a lot of our plans. We couldn't do the filming for some of the resources because we weren't allowed to get onto campus because obviously the social distance and we're in lockdown. We couldn't provide the NHS tours because quite rightly the NHS were diverted looking after the pandemic. So that we had to kind of work around that and use more and more simulation rather than real life events. And I think that did kind of limit the project to a certain extent, because I think before you actually buy into change, you know, to do in a new career, you need to step foot into the area that you may well potentially be working in. And so, like I said, what we don't know yet is because of the time delays within the project, because of COVID, those conversions of interest to sign up and enroll in is yet to be determined. But this has been such a valuable project for us to do. And in terms of income, with my E&I hat on, it wasn't a massive income earner, but actually the value of it, you know, I'm quoting the benefits of this project even now in terms of different conversations I have about different projects. So it's been hugely beneficial. So yeah, thank you. Yeah, finished. Thanks.
Thank you, Vicky. That's great. Such an interesting project. Sounds like you did such a lot. I mean, despite the challenges of COVID, you such a lot of outputs and activity, and it's so good to hear that it was really valuable. I think we'll probably have got some questions for you at the end, but we'll move on now to our next presentation. So Elaine, are you there yet?
I am.
Now we've got Dr. Elaine McNichol, who is the Associate Director of Education for Admissions and Lecturer at School of Healthcare at the University of Leeds. So welcome, Elaine, and she's going to talk about the Challenge Fund project run at Leeds. Over to you, Elaine.
Okay, thank you very much, Robin. And thank you, Vicky, for your presentation. It's interesting listening to it and recognising some similarities. But what will transpire as I go through mine is that our project focused on a younger age group. So as you've looked at mature students, we initially were looking at years 12 and 13, but actually we've spread that out wider by the end of the project. So what I want to do is just try and give you a bit of an overview of the project, the Head Start into Healthcare project, who was involved, some of our project outputs, and like yourselves in Coventry, the adaptations due to COVID, which weren't all bad. They actually forced us to be more creative still, I think, so it was interesting. Some of our next steps and some of the extra things that we've developed, and the experience, I guess, of being part of the SIHED programme. We've done quite a lot of evaluation work. I haven't particularly put that into this presentation. I've touched on it and given links to the evaluation reports that were done for each phase, rather than get bogged down too far into the nitty-gritty of evaluation. So the Head Start project. So we led it like in partnership with our local practice providers, and it was part funded by the Office for Students, and then, as in Coventry, match funded in kind, in effect, with things like staff goodwill to a large extent. It was about piloting creative approaches to engaging with underrepresented groups in health professions, and we specifically looked at adult and mental health nursing and cardiac physiology. And one of the things about our project was piloting it to see whether this approach could then be transferable to other healthcare professions. Could you take one approach and promote 3 different professions within that one approach, and could that be repeated? And as I said, our focus was year 12 to 13 students to begin with, but that did broaden, which are the 17 to 18-year-olds. And our initial plan was to begin our interactions by recruiting into a virtual reality workshop, and then from that recruit people onto a summer school, which was to be on campus, but due to COVID ended up online, and then into an e-mentoring program. So some of the background drivers to this, as we know, there's a shortage of nurses in the NHS and cardiac physiologists and other professions, but in terms of this project, as Coventry has said, there's an underrepresentation of men. It's recognised we need to establish a more diverse workforce, not just in terms of gender, but in terms of ethnicity. But an additional report that came out during the life of this project that was also very important and influenced how we adapted the project when we had the opportunity with COVID was from a UCAS report that said 1 in 5 students are not able to study a degree that interests them. And to a large extent, because they don't meet the qualification entry criteria. And some of that not meeting the entry criteria is not knowing at an early enough age what qualifications they would need to enter into some of these professions. And therefore, when they're making their GCSE choices, setting off on a different route than that didn't allow them to then meet the criteria that was required. So who is involved? We'll talk about our local practice providers. So specifically within the University of Leeds, it was School of Healthcare and School of Medicine. Cardiac physiology is located in the School of Medicine, and a lot of working with our widening participation and engagement team, and a lot of engagement with our current students and also recently qualified alumni students. So some of the input in both in terms of designing the content and then also producing talking head videos, etc., came from our students and alumni. And then our local partners, Leeds New York Partnership Foundation Trust is a large mental health trust that we work with. The Leeds Community Trust, we would have been working with Leeds Teaching Hospitals, but with the impact of COVID, they just didn't have any capacity. And then the local Academic Health Partnership were very supportive as well. So what was involved? Well, initially it was about establishing a representative project team. So making sure that the members of our project team reflected the goals and the aims of the project itself, both in terms of age, gender, ethnicity, etc. Then it was about writing a script for the virtual reality film. I have a whole load more respect now for film writers. Then having written the script, create the virtual reality film, recruit schools and colleges to participate. We focused our recruitment activities for this particular project in West Yorkshire, but going forward, actually we'll be promoting this work nationally to schools and colleges. And then having recruited the schools and colleges, it was about delivering the VR workshops on within those schools and colleges. And then from that, encouraging students and participants, recruiting them into a summer school, then into the mentoring, and then development of additional digital resources to go on a website that was being designed, a bespoke website to support and accompany the programme. So for this pilot programme, we recruited 144 students from 5 schools and colleges. The goal actually was 10 schools and colleges, but just as we started to deliver, COVID struck. So we weren't able to do that. And although we have now done work around it so the VR workshop can be delivered remotely. There wasn't time at that point in time to be able to do that. From that 144, we recruited 58 participants onto the summer school. The summer school, as I said, was supposed to be on campus to give them a feel for the university campus, what it was like to come into higher education, but obviously those went online, and I shall talk about why that number perhaps was a bit lower than we thought. And we delivered a programme of activities. Then from the 58, we had 44 mentees, and then, as I said, that fed into a website, and I shall show you the website. I'll just give you a click onto it to give you a bit of a feel for it later. All phases of the project were evaluated externally by a company called Research Toolkit, and they use something called the Learning Gain tool, which is designed to assess and measure sort of the impact of educational activities. It's been used quite a lot regionally and nationally in outreach programs, and it seemed to match the needs of what we had. The questions focused around the perceptions, attitudes, and understandings of those attending of university, healthcare careers, and in particular adult mental health nursing and cardiac physiology, since that was our focus. We also collected data on gender, ethnicity, and polar 4 quintile representations. So just to give you a little bit of a flavour, there was 22 learning gain questions that we asked at each phase, and this just gives you a little bit of an idea of what those were. So, you know, did they know what an adult or mental health nurse, cardiac physiology do? Did they know what some of the career opportunities that were open to them? What were their perceptions about men and women being able to work in healthcare, and people from different ethnicities and backgrounds, etc. And throughout the project, we were looking to feed in not just the 3 professions and working in healthcare, but also about challenging gender and ethnicity stereotypes, and how to make university, or the thought of going to university, perhaps a more accessible idea and concept for students. Those reports, the data is presented in a number of different ways, and these are just 2 graphical ways that they're reported. So there's written evaluation, but also visual, to make that sort of quick impact of being able to see what difference has been made. So the red is the initial baseline evaluation, and then the green is the repeated evaluation, in this instance at the end of the virtual reality workshops. And then we did the same for the summer school and the e-learning. So the virtual reality film, we commissioned a company to come in and do the filming, but as I said, we ourselves wrote the project team wrote the scenario, and that scenario had a family situation within it, a clinical scenario, a simulated university open day, and then we used the clinical skills suites and simulation to demonstrate what it might look like studying at university, and a shot of the library and things like that. The clinical scenario was chosen and written deliberately so that we could overlay 3 different perspectives for the 3 different professions we were focusing on, so that the viewer can see what's the difference between how a cardiac physiologist goes about their work to an adult nurse to a mental health nurse, and how their training and focus means that they pick up on different things when they're observing a clinical scenario. As I said, the summer school moved online. We ran 15 events over 1 week, and we did that after 3:30, so to try and not clash with school activities. Those 15 events included subject taster sessions for the different professions, presentations by recent healthcare graduates, opportunities to talk to current healthcare students, and also some time spent about how do you apply to university, what's the admissions process like, the UCAS forms, etc. As I said, 58 of the 144 that could have attended signed up. We were hoping for more than that, but I think a combination of lockdown, or the feedback we got was the combination of lockdown, schooling from home, studying already, doing their schoolwork from home, and lack of access to IT and broadband perhaps impacted a little bit on some of the numbers recruited. However, it evaluated well for those that did come, and they got gained from it. For the mentoring, we had 44 mentees. So of those that attended the summer school, 44 of those, which is a good percentage, signed up for the mentoring, and we recruited 24 mentors who were student ambassadors from the university, but student ambassadors who were working in one of the 3 courses, studying one of the 3 professions that we were focusing on. This is already running within our medical school, so we adapted it, an established format for use for this project, and to bring it into the healthcare side of things. Weekly topics were set for 8 weeks as a focus for the conversation between mentor and mentee. It was designed right from the start to be e-mentoring, irrespective of COVID, but that happened to be fortuitous, obviously, with COVID. And the reason for that was safeguarding issues, etc., that it has less complications to run the e-mentoring when the mentoring program is an e-mentoring program rather than a more direct contact. And mentees also had the opportunity to post their own questions for discussion with the mentor. And it's interesting looking at a transcript of all the content of these communications. They asked a lot of questions of their mentors. We asked people why they applied. So the mentees, because they wanted to know more about healthcare careers, they'd found it interesting so far and wanted to know more. The mentors, because they were committed to what they were studying and to sharing what they'd learnt. One of them talked about the genuine passion for their course and wanted to share that. Another one was saying they felt that that would have been very useful for them, this sort of mentorship, if they had been starting now. As I said, it evaluated well. The one thing that we could have done more for the mentors was perhaps a bit more guidance. They were given some coaching and an introduction to being a mentor and guidance and support for that, but a bit more work to be done if their mentee was a quiet mentee. And what's happened, so we've completed that side of things. But because of COVID and having to rejig how we did things, we actually freed up a bit of cash. So we've created some additional resources, with particularly addressing this idea of creating a longer engagement pathway. What's become increasingly obvious is the importance of engaging with students and children as early as you can before they're making any significant choices that might help or hinder them going down a healthcare career pathway later. So we've developed an interactive workbook using the content of the blogs and the talking head videos, etc., from the website. We've created 360-degree clinic room hotspots, which are spin-off from the virtual reality filming. And then we've done some colouring walls and posters as a sort of a low-cost initiative for engaging with a much younger age group. So these are aimed at sort of just those at the top end of primary school. And just to give you a bit of a feel, this is one of the pages out of the interactive workbook. So, and we do this for each of the professions, and we've got some other stuff around working in the NHS and healthcare, etc., about telling them about different aspects of the different roles and what they can go and do. And then they can assess themselves through things like quizzes and word searches and crosswords to see how much they've remembered, engaged, learnt from reading the workbook. A couple of examples of the posters. For the adult nursing one, they're in black and white, so they can be used for colouring. They're designed to reflect a range of different working environments and really just to facilitate a conversation about who can go into nursing. What sort of environments is it? It's not all on a ward necessarily. There's inpatient, there's outpatient, there's community, a whole variety of different ones. We've done one for each profession, and here's one for mental health. Mental health is always slightly more challenging to depict through images and pictures. And one of the important things we wanted to do on this was highlight the key skills and values and attributes that are required to be a mental health nurse, to attract people in. So what we've ended up with is a suite of interactive digital resources and an 8-year engagement pathway that starts from the top end of primary school right the way through to the transition into first year at university. We've got 2 engagement programs from it now, a 3-year healthcare academy program that runs up into the students take their GCSEs, and then a healthcare futures program which is a 1-year programme for those in year 12. And how am I doing time-wise? Have I got time to just quickly go to a website?
Yeah, that's fine. Go ahead.
Right, okay then. I just need to try and stop sharing this screen and go to the website and show you that. So just to give you a feel of the website, because all of the resources that we've developed are on the website, and everybody, they are all downloadable so they can be shared. What we've done is ask people, if people request to download them, there's a form to go to where you just give your contact details and what you intend to use them for, and an email address, so that we can follow up to see what you said being to people, any feedback that's required for how we might then fine-tune things going forward. So we've got 6 different areas where we've put different types of resources into them. So primary age resources, key stage 3 and 4, post 16. And then we've done a section specifically for parents, carers and key workers, and then one for NHS and outreach professionals. So if I give you, so if you go into that one, for instance, there's a video that we've done about what is the NHS. There's a couple of talking head videos. There's a virtual reality film. They can meet different students and what they have to say about their different courses, etc. Just to give them a general feel for things. Right, I shall take you back to the PowerPoint presentation. So just a summary slide, really, around, I think the key things for us were the clarity of the original focus of the project was really important, and having the right people in the project team. So it enabled the challenges to be navigated rather than see them as barriers. And there were plenty that came along. The enforced changes due to COVID actually, I think, resulted in creative thinking and some positive additions to the programme, partly because of the point above. SIHED, I found very flexible and supportive all the way through. So, and okay about us making adaptations so long as we were continuing to deliver on the core objectives. So they weren't rigid, they were able to flex with things, and that made a difference. The pilot's been crucial because it's enabled us to identify strengths and areas for development. And as a result, we've been able to establish a much more comprehensive and sustainable programme of digital resources. Delivering across the 3 disciplines was effective and it worked. And it was a good use of time and resources, and was something I'd repeat. All the resources can be viewed and downloaded by anybody. So hopefully in terms of reach and impact, it'll have an impact out there. Oops, I didn't put it. And that's my final slide with people's contact details if you want, and a link to the website for people to be able to take themselves there. Thank you very much.
Thank you, Elaine. That's great. Yeah, we can see you now. Thank you for that. It's really great to hear, and a sort of a different take on diversifying recruitment to Vicky, but it seems like you did just as much. You both did so many things, produced so many resources, and there was so much activity. And it seems like you both got a lot of benefit and value from the SIHED project, which was great. We've got a bit of time for some questions now. So if you do have any questions, then do feel free to post them in the Q&A box, and we'll try to answer them. We've got some already that have come in. I thought I'd just start with a question to you both, which was that you both talked about the value, and you both described a whole range of activities that you did and adaptations that you had to make because of COVID. Sort of COVID aside, is there anything that you do differently now, looking back at the project now that they've sort of finished in a sense? Wondered if you had any sort of key things that you think, look back now and lessons learned that you think, oh no, I'd probably do that a bit differently to how we'd sort of planned initially.
Do you want to go, Vicky?
Okay. I mean, COVID was the main thing that kind of scuppered some of our plans. What I'll do, I think probably to put a project manager on the project right from the offset, because what happened was we had a collective team that were willing to share the workload. And it worked well to a certain extent, but I think to have that dedicated project management for a project like this that was needing to coordinate so many different work areas was probably something that we would actually invest in next time, rather than trying to do it out of the in-kind contribution from existing staff. I mean, we did end up doing that, but probably we would do it from the offset next time. Yeah, trying to think of anything else. I mean, COVID really did cause some issues, but you know, you're forced to be creative and innovate, aren't you? And because of that, we've got probably more digital resources than what we would have planned to have done. We would have done more open days face to face, which we couldn't have done face to face, but we did online. They worked well as well, actually. So, yeah. Elaine, is there anything different for you?
Not really. We did have a project manager, me, on top, but like you're saying, on top of everything else, rather than, and I think that did help. There was, I also had a business manager working alongside me, which was a godsend. Just dealing with all the figures and making sure we were on track, or when we, so I wasn't having to tie up those sorts of things. So having one sort of central person, I think, was helpful.
Yeah.
Like yourselves, I don't think we did, there's nothing hugely I would change. It was hard work. There was a heck of a lot of work to do in the time frames that were very, very tight. It's quite difficult to show a lot of measurable impact in the time frames that we had. However, you work to fill the time available, don't you, as the saying goes. So would we have been any more productive? Probably not. I think the innovation and the energy that came from this project, so the focus of the funding, and because you could see an immediate return in terms of the development of the resources, the positive feedback, see how that was going to impact on recruitment. So there was quite a quick feedback for those involved in the project, and it was exciting, I have to say, and it's been quite a hard slog through COVID, really, certainly for healthcare staff, with all the challenges for delivering curriculums and students. Although it was hard work, it was quite a nice change.
Nice to do something a bit different.
Yeah.
As you can say, if you could see the sort of immediate value and benefit, then it's always motivating. Thank you. On a sort of similar sort of vein, you both obviously got fund funding, and I know Vicky said, you mentioned that you might not have been able to do your project without it. I just wondered if you had any sort of key takeaways for other universities who might be listening, who also have limited budgets, but might want to do a project or take on activities similar to yourselves. Do you have any top tips for them, or did you find any particular activities or resources particularly cost effective compared to others?
Well, I think we were like you, Vicky. We wouldn't have done such a big project without the external funding. Although having embarked on the VR work and bought some headsets, etc., it was quite interesting to suddenly discover what there was within the university elsewhere. That this wasn't quite so innovative as we thought. It was in healthcare maybe, but actually there was little pockets elsewhere in the university who suddenly got in touch, showing an interest, and had technology and resources of their own. So I think that learning, that there's probably richer areas in a university that sometimes has some fancier kit than you do yourselves. We use some of the funding for VR headsets, but actually we also use funding for cardboard VR glasses, as a more economical way of being able to work with a greater range of students. It obviously then had the additional benefit come COVID of they can take them home with them. You're not taking them back or having to clean them or what have you. But it was useful in terms of the idea of trying to get some follow-up impact, of giving them something they could take home and therefore hopefully use again and come back onto the website and review things through it, or every time they pick it up to go and watch something, nothing to do with what we had talked about, but it would say Head Start into Healthcare on the VR glasses. So there would be this like little reminder at regular intervals of these glasses belong to something that they did and have they remembered it.
Yeah, I think for us, takeaway, I'd say, it wasn't a massive budget that we had, and I'd say don't be put off by that, because as long as you can develop a project that allows you to meet your organisation or supports you to meet your organisational objectives and priorities, then it's worth the investment. Because, and also the other thing is as well, to create a project that can kind of generate some level of enthusiasm, because then you're going to get buy-in from the wider teams, make sure that it aligns to external priorities as well, so that you can get that buy-in from your stakeholder group, which is also important. So I think, in terms of the monetary value, I think I'm glad that we didn't get put off the fact that it was only a relatively small pocket of funding, because the value that's fallen out of it has been huge. So I think, as long as you're developing a project that supports your internal priorities, then I think, it's investment well made. And in terms of efficiencies, the resources that we've used, we're going to continue to use. And in terms of providing efficiencies within the project, we also brought in some existing resources and used them within our sort of open days, and, in terms of engaging potential students. So we did bring in resources as well. So yeah.
Great, thank you both. You both, technology seemed to be a sort of key part of both your projects, and you both produced a lot of digital resources. You both sort of seem to use VR. Did you come across any particular difficulties with using technology? I know, Elaine, you mentioned other help from across the university, but would you it seems like you would both say sort of the use of technology was definitely beneficial and definitely added value. Would you both agree? And did you come across any difficulties?
Intellectually, I think technology is great. Emotionally, I'm not a big lover of it. You won't find me spending a lot of spare time on it, but I get the importance of it, and I get the importance of engaging in different ways, hence putting this bid together or what have you. And I think what it's done is energize other people. So actually it's energized another team within the School of Healthcare who've just put in a quite a big size bid and won it for this sort of technology for midwifery, or it's part of the midwifery bid. I'm not sure if that would have happened. It's sort of, oh, right, it demystified it a bit, and by making it a bit more it demystified it a bit. And because we engaged a lot of people and we did a simulated open day and things like that, it was, so people got it was something a bit different. People got a taste for it. And then I guess it's the knock-on impact of COVID of suddenly, as opposed to talking about doing things, it's had to happen in different ways. And therefore it's become less scary to people.
Yeah, I think, definitely. I mean, COVID, the way, it's kind of forced people to think differently, whereas perhaps previously we might have put up some barriers. Overnight we need to work differently. So the fact that, we as an organisation, it sounds like your organisation too, Elaine, in Leeds, already embraces technology, actually. And I think when you are developing digital tools, the thing that you have to have at the forefront of your mind all the time is accessibility, and not creating a further divide, through digital poverty. So all of the resources that we developed were web-based, that people didn't need to have a smartphone to access them. So we tried to keep it, as open access as accessible as possible, because you do need to be careful about not creating inequalities by providing, all of this through a digital means.
Yeah, I think COVID has taught us the benefits, but also the downsides of technology. Definitely all learned that in the last year. Vicky, we did have a sort of specific question for you. It's about midwifery, because I think maybe you mentioned nursing and allied health sort of resources and case studies, but the specific point is being made that men are very underrepresented in midwifery.
Absolutely. And it's fascinating, isn't it? Because if you think about obstetricians, many of them are males. And yet when it comes to midwifery, we did actually, and if you look into the website, there's a chap called Craig Saunders, who was our one midwife student that had gone into that. So we called him back and said, please do a video for us, which he did. So we did manage to get hold of perhaps one of the only midwives in the country. I'm not sure how many there are actually that's, you know, male. So yeah, if you look into the website, Craig Saunders is the chap.
That's great, thank you. And I think you both said that a lot of the project sort of relied on staff volunteering their time and just their sort of willingness to sort of engage and to do stuff on top of their day job. I think there is a question about the funding allowing you to buy out staff time, but I'm assuming it was more on a goodwill sort of basis that you both had volunteers for the project.
The funding wasn't allowed to buy staff time. So staff time was out, if it's going to be freed up, had to be either underwritten by the School of Healthcare or it was on top of. I think it's the old chestnut, if you can demonstrate how it's going to be a benefit to somebody and deliver on an important objective for them, then they can see, you know, is that what's in it for me? Not in a selfish way, but, you know, I'm already busy and you want some more of me. What am I going to get out of this? It's going to help me with my day job. So it was making those links explicit for people. And it wasn't difficult because, you know, folk are perhaps looking to develop materials for teaching, or their course isn't recruiting well, so they're worried about the sustainability of it, or it's not very diverse. So there were quite a lot of hooks to be able to do it. And then you've got someone who just wants to do things differently, and we're engaged in that way. So yeah.
Absolutely. I think it's the power of persuasion and convincing people, actually, yeah, it might seem like it's on top of your day job, but actually it is your day job, because for us it was a marketing campaign. So we did manage to convince the marketing teams, look, this is marketing. This is an opportunity for you to do something funky and creative with funding that you wouldn't normally be able to do. So we did manage to do that. And we did get a project manager, but because we'd involved the wider STP in terms of our engagement group and our stakeholders, we had HE representation on there, and obviously interest from the LWABs in terms of the project. And so we did get some support there to buy out some time for project management. We were really fortunate. And that kind of helped us to kind of keep the project on track, because there was just so many different work streams. It was really hard to manage. So that was a godsend, really.
Great. Well, thank you both. Unfortunately, we've run out of time there. We could go on discussing because it's been so insightful, and thank you for sharing with everyone your projects. Hopefully everyone has learned a lot from them, and it's been really great to hear how you've both gone about diversifying recruitment for healthcare disciplines, but in quite different ways. There's and great to hear how creative and innovative you've been with those. Thank you both, Elaine and Vicky, again for speaking, and thank you everyone for listening. Hopefully see you all in a few weeks' time for our next webinar. Thank you.
Thank you.
Thank you.
Thanks all.